Most people probably feel like the most challenging thing for any caregiver is feeling hopeless, feeling like you can't do anything to alleviate your loved one's pain and suffering. But for me, the most challenging thing is, how do you juggle it all? How do you give your loved one the best care possible while also maintaining everything else that's going on around you? In my case, I'm trying to take care of my dad along with my mother. I have a husband, children, I work full time, I've got outside commitments, I'm active in my church. For me, the most challenging thing is, how do you juggle everything?
Taking care of an elderly parent is not easy. I've learned a lot about myself. I've learned to become a very patient person. When you're up and about and you're kind of just doing what you want to do and you're running when you want to run, it's a little different story when you have to put a wheelchair in the car and then you have to help someone get in the car and you have to buckle the seatbelt. And it took me a long time to become patient in being able to do such things for my mother. I think the other thing that I have found that is it's okay to say no. As a caregiver and you're doing things, I've learned to tell people no and not feel guilty about it. People say, can you come and do this? Can you come and do that for me? And a lot of times, people invite me to go places and I can't. I just can't go because my mother needs 24/7 care. My mother also has dysarthria, so it sounds, for those of you who are not in the medical field, it sounds in her talking to me, it's like talking to someone who's drunk, someone who has very slurred speech. So I've learned to be very patient in terms of her movement and in terms of listening to her talk. It's very difficult, and you just have to do what you have to do. And I've learned to have a very good work-life balance. It's a little as times it gets out of balance, but it's just something that you just continue to do. I love my mother. My mother took care of me, and now it's my time to take care of her.
As a new caregiver, the most important first step is to know yourself. Know what your capabilities are. Know what you can handle physically, emotionally, and even spiritually. Once you've determined that, the decision to become a first-time caregiver is a family decision. If you're single and you only have to make decisions for yourself, no problem. But if you're married and have a family, it's a family decision. You have to sit down with your family and make sure that you all understand the commitment that you're making. And most importantly, be open to help. Not afraid to ask for it, not afraid to say what you need, and not afraid to hire someone, if necessary, to support you. The most important gift you can give your patient is love, compassion, and understanding. And by knowing yourself and preparing yourself and being open to help, you can do that the best way possible. Good luck.
So the question that I was asked was, what do I wish I had known prior to becoming a caregiver? And I wish I'd known about the importance of self-care. Self-care in the sense of trying to eat right, exercise, get enough rest, and pamper myself occasionally. I also learned the importance of surrounding myself with as much positivity as possible, because after becoming a caregiver, all my energy, time, and attention has to go towards caring for myself and my loved one. So those are the things I wish I learned or knew before becoming a caregiver.
I became a caregiver in June of this year for both of my parents, my father, who's a World War II veteran, and my mother, who's a retired nurse with over 40 years of experience. So although caregiving can be very stressful at times, it's even more stressful during a global pandemic. However, I have found many joys in this, including spending quality time with both of my parents. We enjoy reminiscing over old times and things that have happened in the past, watching movies, watching TV. Also, recently we've been able to experience some historical events together. So I really am blessed to still have my parents at this time in my life. So I'm grateful and I'm very blessed. So for all of the caregivers, enjoy the time that you have with your loved one. May God bless you and give you what you need for this journey. And remember that the joy of the Lord is our strength. Thank you.
Each of these caregivers have shared some valuable information about their caregiving experience. My name is Dr. Cedrina Ruffin. I'm a licensed clinical social worker with many years of providing care for caregivers and helping them cope with their caregiving experiences. I want to start off by providing some clarity on what a caregiver is. A caregiver can be a family member or a paid helper who regularly looks after a child, a sick elderly, or a disabled person who needs some degree of ongoing assistance with everyday tasks on a regular or daily basis. Caregivers work tirelessly to provide care, whether it is financial, medical, domestic, or emotional support. Caregiving can be a rewarding job, which provides a sense of fulfillment for many caregivers, helping them feel needed and useful. Some have often reported that their caregiving has allowed them to learn more about themselves, others, and their connection with life. As mentioned, being a caregiver can be a rewarding and fulfilling job for many, but for others, it can be viewed as physically and emotionally draining, increasing their risk of negative health conditions. Caregivers often sacrifice a lot of time, energy, and their own physical and emotional needs, which lead to stress, anxiety, and depression. I want to provide a few tips on how to cope as a caregiver. Unpaid caregivers such as family members, close friends, spouses, adult children, and siblings often fail to take advantages of various support services. This is because they often don't view themselves as a caregiver. This is why we must never underestimate the strength that caregivers have for providing their support to the individuals who need it the most, nor the toll that it takes both emotionally and physically upon them. Caregivers often become overwhelmed by the complexity and challenges of their caregivers' tasks, such as the administration of medications and managing their health and financial obligations. These challenges often lead to increased stress levels and often burnout. It is essential for caregivers to take time out for themselves and cope with their caregiving responsibilities. I want to remind you that self-care isn't selfish. It's important to take care of your own health. Pay attention to signs of burnout, stress, anxiety, and/or depression. Signs of depression can include isolation by avoiding pleasurable and meaningful activities because you feel guilty about taking time off from caretaking. You may have an inability to sleep, feelings of exhaustion, or severe tiredness. Signs of anxiety can include symptoms that present themselves as constant fearfulness and worry, trouble eating, shortness of breath, heart racing, and in some cases, constant irritability. If you or someone you know are experiencing any of these signs or symptoms, please consult with your doctor or contact a licensed mental health professional. I want to provide you with some self-care tips, and this is for caregivers. First, care for yourself. Caring for yourself is one of the most important and most forgotten things you can do as a caregiver. When you are well taken care of, the person you are caring for will benefit too. Take responsibility for your own care. Remember, you are not responsible for the chronic and progressive illnesses of the person you are caring for, but there is a lot that you can do to take responsibility for your own personal and well-being and to get your own needs met. Next, identify your personal barriers to self-care. Not taking care of yourself can be a lifelong pattern, while taking care of others can be an easy option. We must not neglect ourselves by putting ourselves on the back burner or second to others. We must identify what is the way we most effectively care for ourselves and being as healthy as we can be, emotionally, physically, and mentally. Sometimes caregivers have certain misconceptions that increase their stress and get in the way of self-care. I also want you to reduce your personal stress. The stress you feel is not only the result of your caregiving situation, but it's also the result of your perception of it. It's how you view your role as a caregiver, whether you view it as your experience as a strain, distress, or resentment. I want you to evaluate your coping abilities with stress as well. Ask yourself, how have you coped with stress in the past? And how would you like to cope with stress now? It's also beneficial to identify your current coping strengths and build upon them. I also would like for you to do this. Set goals and seek solutions. Setting goals will allow you to become more effective and efficient in your caregiving role. Take breaks as needed from your caregiving responsibilities by seeking and accepting help from others who can occasionally give you relief. As problems arise in your caregiving experiences, take action and resolve them immediately. Also, I would like you to foster effective communication. When you communicate in clear, constructive, and assertive ways, you are most likely to be heard by others. When you're in need or not feeling yourself, communicate this to someone. Anger, frustration, and sadness are common symptoms and signs that a person is not feeling like their normal self. If you need help and would like assistance, just ask. And finally, talk to your physician if you experience any signs or symptoms outside of the ones mentioned in this video, because this is an indicator that extra care and attention may be warranted.